One of the greatest problems in healthcare today is the problem of variation in quality. Variation is endemic in American medicine, and it frustrates doctors, it frustrates hospitals and hospital leaders, it frustrates the public. It's almost as if everybody's got some story of something that shouldn't have happened. And there are best practices for some things in medicine, but other things are just left to the individual discretion of a doctor. I appreciate that trust that society's given me to use my discretion. I appreciate it when patients say, "Doc, tell me what you would have done. What would you do for your own mother or father?" We need that discretion to have the liberty to tailor treatments to patients. But unfortunately, without good transparency and accountability, that discretion gets perverted into the Wild West of medicine. And that's why we've got a situation where an amazing field like cardiology is plagued with a bad rap because a small fraction of cardiologists put in unnecessary stents. Or a field like back surgery, where you've got orthopedic and neurosurgeons doing tremendous good for patients, relieving them of their back pain, and a small fraction of those doctors doing it for inappropriate indications, giving the field a bad name. So doctors, groups, and hospitals are charged now with this task to deal with the problem of variation. And one way they're dealing with it is to say, let's get together in collaboratives. Hospitals, many hospitals now are in state hospital association collaboratives, they're in quality initiatives, and they're in collaboratives with their professional associations. Doctors are working with the doctors' groups to endorse developed quality metrics with definitions that they define and come up with ways that there should be a consensus for, to come up with a consensus. There's variation in quality, there's also variation in prices. The public is increasingly saying, we want to see more standardized high quality, and we want to see more standardized set prices that don't have as much variability. Now, whether or not this will actually translate into better care is something we have yet to see. But right now there's a movement in American medicine among U.S. hospitals by physicians and by in part driven by patients to have more transparency across the board on many of these issues. We were very pleased to see the widespread adoption of checklists around the world, especially with the World Health Organization adoption. But I have hospital leaders come up to me and say, we've downloaded the checklist, but we're not seeing a change in behavior or a change in outcomes. And one of the issues is that a checklist without the context of a culture of safety can be a perfunctory step. And doctors can go through the motions, nurses can read off the items, and people can have a moral hazard when it comes to safety, relying on some of these systems rather than recognizing the role of personal responsibility. So a checklist without the context of a safety culture is potentially even dangerous. We've tried to talk about checklists in the context of briefings. And actually the original articles that we wrote on checklists were titled Operating Room Briefings. And the reason is that it should be a discussion. It should be an opportunity to level the hierarchy, to encourage people to speak up, to recognize people, to remove the veil of anonymity that results in so much disruptive behavior. 80% of nurses and 50% of doctors say that they have witnessed disruptive behavior in the preceding months, according to a recent study in JAMA Surgery. Dealing with these issues sets the boundaries for behaviors and helps instill a culture where people feel valued, they feel that they can speak up when they see something that doesn't look right, and it creates a good workplace environment. We know culture's tied to nurse turnover rates, it's tied to physician turnover rates, it's tied to patient satisfaction. So all of these things are the context for something like a simple tool like the surgery checklist. What TripAdvisor has done, as well as many of the other experience-related travel sites, is they've taken the outcome of that service industry, which is the experience of the customer, and made that a transparent outcome. And because of that, there's been accountability in the industry. And when TripAdvisor moves into a city, every hotel moves up in quality. And over time, there's a tremendous impact on minimizing variation, almost eliminating variation in quality with that transparency. And those that are enthusiasts for patient satisfaction are saying, hey, we could do this in healthcare. We can minimize or decrease the variations in service quality by making satisfaction scores public. In the same way the Cleveland Clinic and the University of Utah are posting their patient satisfaction scores voluntarily by doctor on their website.